Good afternoon. This week our topic is women's health with our specialist GP. Okay, and so hello my friends. My name is Anjali. I'm health and wellness coach. I'm going to wave Dr. Francis, and yes, and of course I am the founder of this page. And this week we have very special guest, Dr. Francis Knight, and I would like to read more about her. Okay, so Dr. Francis Knight is MBBS, FRACGP, RANZCOG. How would you say it? Hello everyone, thank you for coming. I am ZCOZ CWH, NDC accredited. Sorry, my accent. I'm locally trained general practitioner with a special interest and extended skills in women's health and pediatrics. I enjoy providing care that is personalised, comprehensive, and compassionate. As a specialist GP and mother of four, I offer both professional and real-life expertise for women and their families. So I'm going to check Dr. Francis' request. Thank you for joining in. If you have any questions, please get ready and we will have the question Q&A at the end, okay? Thank you. Hello, Dr. Francis. How are you?
Hello, how are you?
You're here. Thank you for coming.
Yeah, I made it. I made it into the technology.
Yes, you did. Yes, you did awesomely. That's fantastic. Yeah. Thank you for your time and your expertise to educate our community this week, and we truly appreciate it.
Well, thanks for inviting me. What an honor.
Yes, awesome. Oh, thank you. Hello, everybody. Thank you for coming. So before we start the conversation, I just wanted to say that this is just for the information and educational purposes. This is information that we're talking. It's not, it's generalized, right? It's not a specific diagnostic for anybody. So if anyone is having health issues, please go and see your health and wellness professionals, and yes, and look for support. Okay, so anything else you would like to add in?
No, that sounds great. Yeah, great.
Awesome. So we will start our question. So who is our number one question is very simple. Who is GP and what is your role in women's health?
Good question. Good starting point. So a GP is a general practitioner, and we are, I guess, similar to our other colleagues like obstetricians and gynecologists and cardiologists, in that we have done our medical school training, we have done our general skills training in hospital, and then we've chosen to specialise in a particular area. GPs choose to specialise essentially in everything, so we are designed to be sort of a first port of call, long-term, I guess, relationship with patients, and yeah, just really get to know our patients and support our patients. So that's what a GP is. In terms of our role in women's health, well, it's quite varied. We can do a lot of work in women's health, and I think we're seeing that a lot more now. Many of us, like myself, are developing a special interest and extended skills in women's health things. And so the benefits we have of our role as GPs is that there's sort of the medical side of us, so we can see our patients, you know, say with a problem, and we can assess and investigate and manage that problem. We can refer to that a different colleague if we need to manage that problem. And We can look at, health prevention and screening and optimizing health for things like pregnancy and menopause, and sort of coordinating team-based care for someone in their health journey. But then there's also other facets to our work as well. So one of them is our sort of more general advice and counselling side, because our patients come to see us every day, every year of their life,
Yes.
Across a range of issues and journeys. And so we're often giving advice of how to navigate through life. My work in particular, it's often parenting. So navigating toddlers and navigating teenagers, advice about, I've just had a divorce, what am I going to do? And those sorts of more general topics. So I think that's a really valuable part of our role and something I really enjoy. And then for me, certainly there's the mum life side.
Yes.
Parents often come to see me because they know I'm a mum, and so they want to know, okay, what does the doctor say, but what does the mum say? What's the best thing for me to do? Because GPs have their own lives as well, and we have our own experience that we bring to our role. And so really, most importantly, the best thing about our job by far is that we get to know our patients over time. So not only can we help you through your life in terms of maybe we've seen you as a child, and then you're a teenager, and then you're ready for babies, and then you'll have babies, and then you're menopausal. That's amazing. But we also know your health history, so that saves a lot of time. If you come and have a regular GP and then something comes up, we can fast track whatever we need to do to help you manage that. And it's also we're picking up on things when we know you. I can tell from the waiting room with my patients what they're in for often. It's either a glow and a smile and a partner's there. Oh, I think they're pregnant. Or it's oh, gee, they just don't look quite themselves today. And what's up? What's going on? So it's such a privilege that I really enjoy in my role as a GP, is that long-term care. And I don't like having to choose, I'm only going to see you about this, about your heart, for example. I want to see you about everything.
Yes. No, I think, GP knows their families more, more than family knows each other. You know what I mean? We open to our doctors more than to our own families. I think that's why you would know better. You know us better than anybody else, I should say. Yes.
Definitely,
it's like
sometimes.
family bonding. Okay. So we that was beautifully put together, that who is GP and what is your role as in women's health. Thank you. And if our audience, viewers, if you can hear us, please give us a thumbs up, or if you can't hear us, give us comment. Thank you so much for coming here today. And our number 2 question is, I saw in your bio that your special interest is in women's health. So what are I think you already covered that bit, what are the things you look into under women's health, like menopause, pregnancy, parenting, and did I miss anything?
No, I mean, look, I guess we think of women's health typically in a traditional sense that women's health is about things that are unique to us, so breast issues, pregnancy, periods, our organs, uterus, ovaries, those sorts of things. But by and large, I think now women's health is so much more, because we're so much more. We are more than our breasts and our pelvises and our pregnancies. There's more to us. And so for me, when I think of women's health, it's actually about supporting the whole woman and what her needs are. If we take, say, a woman with endometriosis, for example, then sure, we've got endometriosis that we're going to look after, but then there's the other things. So how is the pain, managing the pain? the heavy period. What are the impacts of that? And then maybe there's impacts on bladder and bowels and sexual function. And then there's how is that impacting her day-to-day life? Is it impacting on relationships? Is it time off work? You know, so there's all of that in this sort of women's health topic that we need to support and we need to address. And then we've got a longitudinal journey in that of thinking then about a longer term, okay, well, if we're going to think about pregnancy down the line, maybe we need to start that conversation earlier for this woman, or maybe we need to think about fertility preservation. And then also throughout the journey, it's about just being there as a support. So I see my role in education really, you know, educating about things that come up, sifting through different symptoms, because just because you have one health condition doesn't mean you don't have another. And many times things overlap. So it's helping her sift through what's what, and then supporting her through that journey that she will, you know, some health conditions we're carrying through for life, you know, things like diabetes. And that's usually a lifelong. So how can I help share that weight of carrying that with you?
Oh, that is beautiful that, you know, you're not just there, you know, like if I come with a one condition, you're not just going to look at that, but as a whole person. And it's, yes, and that is so beautiful because it's all intertwined, right? Is women's health is so, yes. Last week when I had a live with, yes, it was a queenager, you know, like, you know, we're going through, and it's like our women's health is so intertwined. And then but anyway, God, we're talking about queenager. I was thinking of the that she said about the menopause, you know, why don't we call, instead of saying menopause, she would like to use the word queenager. So I was like, that just, I still remember that. But anyway, Bump Fitness, thank you for your feedback. Thank you. She can hear us, thumbs up. So that's good. Yes. So we have just covered our second question, and our third question is so it's more like for new moms, you know, because being a new mom is so, sometimes it, you know, it can be scary and, you know, lots of questions. And so when they come to you, and how would you guide them towards the next steps, or what are the next steps you would do? Just, you know, if any one of our viewers are pregnant, and then if they have questions. Yes.
Yeah, so certainly that's a common time, but actually, you know, sometimes the journey even starts before that. Increasingly, women are coming to me, or GPs in general, before pregnancy to prepare for pregnancy. And that's lovely, because then by the time they have that positive pregnancy test, we already know each other.
Yes.
And that can be maybe a little bit less daunting than, I'm pregnant and now I've got to go and see someone and find out all of this information. So that's a lovely beginning, I like to have. But otherwise, so typically you think you're pregnant, or you've got suspicions that you're pregnant, or done a home test. So you've come to see me or one of my colleagues, and the first thing we do obviously is have a chat, get to know each other, and look at what's sort of the current state of the health and what we need to do from there. So there's things like making sure we're taking the right prenatal vitamin. So having, you know, supplementation for folic acid and iodine is important. Making sure that if there are any health conditions, are they going to impact on the pregnancy, or are there any special considerations we need to look at in relation to that? We're checking in, of course, on medication safety. So if there's any medications that we're currently taking, just having a look to make sure that they are going to be okay to continue in pregnancy. And look, most of them are, I would say, by and large. And then, you know, how are we feeling about a pregnancy? Because sometimes a positive pregnancy test isn't a good thing for some women. So kind of unpacking how we're feeling about that, and you know, if we need to change our management on that. And it gives me an idea already of the kind of life and supports that a woman has, and you know, how she wants to run this journey, because we talk about what we do in pregnancy and all these sort of steps, but of course everything is optional apart from having the baby. And each woman, we want them to feel empowered to design their own way.
Yes.
And to really understand the reasoning behind what we're doing along the way, so that she feels safe within her own body, that's going through a big change, and feels that, you know, we're addressing any concerns that are coming up, and she has I guess, a safe place, so that if she's starting to feel a certain way or starting to worry about certain symptoms, she can just raise them and we'll just look after them. So that's really, you know, a big part of the first appointment. And then, of course, we are referring on usually for a blood test and early pregnancy ultrasound, which is called a dating scan. And we often do dating scans just to check that, one, the baby is in the right location, so inside the uterus. That's quite important. And then two, that the age of the pregnancy is aligning with what the woman thinks the age of the pregnancy is as well. Because so much of what we do in pregnancy is about how far along we are or how pregnant we are. So it's good to get that right at the beginning, I suppose, and just make sure everything's on track. And the other thing, of course, is making sure if there's one baby or more, because you can imagine how that changes the conversation a little bit.
Yes.
So that's the typical first step. So we'll have a chat, get to know each other, answer questions, talk a little bit about, you know, what's important, what their values are, refer off for a blood test and an ultrasound, and then we'll circle back to meet again, talk about those results, and keep working through the stages that a woman would like to participate in for her pregnancy. And of course, things like what tests she wants to do, who she'd like to deliver with, how she'd like to deliver her baby. All those things come up along the way as well.
Yes. Yeah, that was beautiful, you know, answers. But, you know, when you said positive result is not always the good, might not be always a good news for people. And I was like, at first I was like, you can see, I was like, well, how come it's not good? Because, you know, I was putting myself in everyone else's, you know, like everyone should, you know, but yeah, my apologies if I look a bit stunned in that, but I respect, you know, everyone has their rights to do whatever they want to do. It's their body. And, you know, I totally respect that. Yes. And yeah, thank you so much for that. Yes, so yeah, you opened my eyes, and like I caught myself, you know, like, oh, hang on. Yes.
That's good. That's learning, isn't it? And that's what we're all here to do.
Yes, absolutely. Yes, and then the fourth question, we just did the what would be for the you know, step for the pregnant mom when they come to you. Third question, and the fourth question is as you have mentioned that you provide support, postnatal parenthood support, and what does it look like?
Yes, this is my big passionate area. I'm really, really passionate about looking after mums postnatally. I think we do pregnancy and birth pretty well overall. There's lots of support, there's lots of appointments, you know, everyone wants to know about your bump, and everyone, you know, everyone's there. But then we bring our babies home and the support drops away somewhat. And for some, that's a blessing. You know, they love that beautiful newfound independence, that time to just make that little family bubble. But for others, of course, it's really daunting. So it's my role to sort of help. Well, I think it's my role to help, if women would like, navigate that journey, because there's such a lot going on. We've got this beautiful new baby who is just learning how the world works, how their parents work, you know, all these growth and development within their brain and body. Babies learning lots of skills like, you know, being in the outside world, being away from mum and those sorts of things. And then we've got a mum trying to learn lots of new skills as well. But of course, at the same time, she's having these hormonal changes, and she's, you know, maybe breastfeeding for the first time and having, you know, hormonal changes from that. And then she's not sleeping in the way she's ever slept in her life with all the broken sleep.
Yes.
Her, you know, emotions are designed to be, you know, all over the place. She's probably realizing a lot of things about other people around her that she may not know. So there's a lot. There's a lot going on, and so part of my role to support is really to help kind of, I guess, cocoon around this little bubble of this new family, and help support generally, but also manage any little issues that are coming up, because all the little things that are going on, you know, the feeding and the sleeping and the settling and mum's recovery and the support, they all interact with each other. And so if one area is a bit off, that can really impact on everything else. And so it's being able to know that family and sort of work through, okay, so you're telling me you're feeling like something's going on here, but actually the problem's over here. And so if we, you know, if we can look at both, then that's helpful. So that's kind of my aim, and I try to do that really by starting off in pregnancy. So the women I see in the 3rd trimester of pregnancy, as part of the antenatal care I start some education, just very light, just around, okay, what to expect, you know, and just sort of checking, oh, have you thought of who's going to help support you? Have you thought about little things like this? And then we're meeting early, you know, in the first week after birth, usually, to check in, and then very regularly. Medicare typically only sort of thinks about a postnatal visit from week 1 and then week 6, but 5 weeks is a really long time in the postnatal journey. So I'm often seeing women and their babies far more frequently than that, and it's so okay for women to do that, to seek more support. And then, you know, it's bringing in my colleagues when we need to. It's bringing in, you know, a lactation consultant if need be. It's bringing in a psychologist. Those are probably the 2 most common that I would bring in the early times. And then afterwards, it's our beautiful pelvic floor physio colleagues and, you know, other people along the way. Paediatric physiotherapists, for example, are fantastic as well to help with baby's development. So, yeah, it's just cocooning and making sure that I guess things are on track, and that we're always looking at the whole picture, because we often get very dialed in just to one thing, but it's actually the whole picture where we see what's really going on. And so, yeah, a lot of postnatal support as well. And in fact, you know, I know how busy it is in pregnancy. We're often working so much to try and save up for my maternity leave, and we're supposed to do all these classes, which are usually great, but it's trying to get the time to do that and get our partner along if we have one, and do all those. So actually this year I'm going to start some online classes for pregnant women and postnatal women, where they can just sit at home, whether it's after work, on the couch, when they're pregnant, just really light, just, okay, my first one is called What to Expect Beyond Birth. That'll be launched soon, and it's just very light, very low key, super easy. It's the first step to prepare for looking after yourself postnatally, And I'm excited for that because I think that will make it easier for women to be able to access that support.
Yeah, prepare themselves,
Mm.
right? Because, yes, and I love how you start educating them from the, third trimester, so they can be like aware what is coming and not to be overwhelmed by it.
Yeah.
Yeah. And so we just, and if you just, earth body balance, thank you for coming. Yeah, I was, so we just covered, so we just covered that how you provide support postnatal parenthood, right? And now we're going to ask a little bit personal. So, being GP and mother of 4 children, how do you take care of your health and wellness?
Well, that's an ongoing learning curve, isn't it? So, well, let's say how I try to take care of my own.
Fair enough. Fair enough.
Yes, because look, I think these kind of things of work-life balance and wellness, sometimes it's not a destination, it's a journey, isn't it? And so I feel like I'm on that journey very much so, and always trying to stay on the train.
Yes.
But it's not a destination that I'm going to get to at a certain point and then just, oh, okay, I'm there. I don't need to do anything more. It's always, which is great. So I think what works for me is having, really clear values. So, for me, mostly it's about parenting. So a really clear parenting value of what kind of parent I want to be.
Yes.
And then, it might be a what kind of GP I want to be. And I keep those as like a guiding light, I suppose. It sounds a bit fluffy, but as a navigation point. And so I just focus really on continuing on that journey towards that navigation point. And then when things sort of come in along the way, it helps me make decisions, set boundaries, prioritize or lower standards, whichever the case may be, a little bit easier. So that then I can, something comes up and I can say, oh, okay, how does that kind of fit with that value that I have? Is that going to bring me closer to that value? Yes, okay, great, let me do that. Whereas if something's less so, then I could say, well, no, that's probably not going to be aligned. So that probably for me is key, is just having a roadmap, because otherwise, what am I trying to work towards? And it's really, I'm very visual, so having like that vision for me is so important. And then setting boundaries. It's all very well to say, oh, no, that's not going to be useful, but how do I then say no? And that takes practice. It's like a muscle. You just have to practice saying no. Sometimes it's just a full stop and a smile. That's all you need to say.
It takes a lot for women to say no.
Oh, yeah, absolutely. But it just takes practice, and over time I'm getting better at it. And so setting those boundaries or saying, okay, when I'm in, these hours, I'm on, and so please contact me, but don't contact me at 1 o'clock in the morning on a Sunday. I'm sleeping, those sorts of things. So it's having, for me, boundaries like that. And then really I like to tune in. I'm not one to let things fester. If I'm sort of going, oh, okay, this week I'm just getting a little frazzled or oh, I'm feeling really tired, I don't just let that fester and keep moving. I just sit with that for a moment and go, okay, what does that mean? What is that about? And then go and do something about it. And it might be something super simple like, oh, I just haven't had a chance to exercise this week. I just need to go out on the weekend and get some fresh air. Or other times it's like, oh no, I was tired last week too. And okay, I'm just going to go see my GP. Just bite the bullet, get it done, find out what's going on. So, and then I'm not carrying that to do or that worry or that heaviness of whatever's going on around. It's just, okay, got you, received, check, move on. And then I have this kind of clearer path towards my
Yes.
value, I suppose.
Yes.
Yeah. So that's really good. That's helpful for me. And then I have a good support network. I have amazing husband who's very helpful and has been trained very well.
Oh, bless him.
So yeah, and we tag team pretty well and are quite good communicators, and that's really important. I have amazing colleagues who are very accepting of the fact I do work part-time. I'm a mum first, I always will be. So they're really helpful. And just those sorts of supports, because it's a village. There's no way I would even ever pretend to try and do this alone. There's no chance. It just, I'm not going to try and be a warrior, you know, in that. It's being part of a village is so helpful.
Yeah.
So those would be my ways, I suppose, that I'm trying.
That's beautiful. So what I took away is setting boundaries and your values, and get the things done that what is niggling you, and so it will be clearer, you know, where you want to go.
Yeah. It just takes it off the table, you know, just book that pap smear, you know, it's just get it done, get it out of the way. Yeah.
And say no. Say no.
Say no.
But it was very, very difficult for me to say no and to have an uncomfortable conversation. But then I started listening to, I don't know if you're aware of Robin Sharma. So he says, as long as you put the information with love and respect, and so the person, you know, who is the next person will feel you, that there is no, you are not judging them, but you truly mean that, you know, with love and respect. And after that, I could, you know, I felt relaxed and I could put my thoughts in. Yes. So that is, it was beautiful.
That's right.
So, okay. Yeah, no, thank you so much. So we learned so much from you. And is there any final advice to our women community that you would like to give out?
You know, we were talking earlier about, you know, the value I think you're really adding to our community. And so if speak up is probably what I really would love women to do more of. Easier to say, not so easy to do. What I mean by that is being able to give yourself a chance to tune into your body and speak up if something's not right. Either speak up to yourself, stop denying it, speak up to yourself, speak up to your healthcare team, to your GP. Oh, something's not quite right. I've been tired for too long. I'm more tired than I should be. Please, can we have a look into it, as an example? So that's one. Speak up, I also mean in terms of like saying no is a thing. Being able to communicate your needs really clearly, I think, has helped me so much. It's something I've only fairly recently learned to do, and I was talking about, I love this with one of my beautiful patients today. Sometimes, particularly in parenthood, we are doing 100,000 things, and maybe a partner is on the couch watching TV or something like that, and we're just, we're struggling with all these things, and we're saying, why isn't anyone helping me? Why can't someone see that? Why, you know? And we have all these emotions around that, but sometimes we just need to let all that go and just say, well, look, we can't control others sometimes, and if we can just communicate our needs more clearly, whether it's in a relationship or with friendships or with a healthcare team of, hey, look, I'm struggling with doing all the housework and looking after my baby. Can you please take over this or that? Or hey, look, boss, I'm not going to be able to meet 5 deadlines this week. Can you please outsource a project to someone? Or, you know, just being able to say, I'm feeling this, I need this from you, rather than sort of expecting people to pick up our
Yes.
subtle cues. That's been really helpful. And I think if we can do that more as women, then we support each other. And
Yes.
because sometimes, you know, when women are speaking up, we're sort of feeling like, oh, now we're a bad person, or now we're that woman, or now we're a difficult person, and it's not like that at all.
Yes.
So I think if we can do that for ourselves and each other, that's good. And then the last way I would hope that we can speak up more and is in our community, especially about difficult topics. So things that we find hard to speak about: miscarriage, fertility concerns, domestic violence, mental health, sexual abuse. If you're comfortable, if you get to that place where you're comfortable to share your story, like you have actually, it's so beneficial. I can't speak so much in broad terms to the individual benefit back on you, but to our community it's valuable because it helps people feel like they're not alone, and it highlights problems that we could look to improve outcomes for. So, yeah,
And giving,
speak up if you can, if
yes,
you're willing.
and yes, and giving the voice to other people as well, right?
Yes.
So when you, lots of people, they stay quiet because they feel like they are lonely.
Yes.
But yes, but we are, we are all in this together. And if someone is coming, speaking up, and we can all hurdle together and, create that community.
Yeah, absolutely.
Yes. So speak up, say no with love and respect.
Again.
Yes, and don't feel bad about, you're not going to be a bad person just if you are setting boundaries and saying no. Yeah. I think it will even more help to build the relationship with the other people because you are speaking up, so they will know what you exactly want, right? And it's like so much clearer and less chance of building up and then blow up one day. That is what
Exactly.
I used to do in the past. Yes.
Yeah. I think we can all be guilty of sometimes being a little passive aggressive maybe, or letting things build up and then just we explode. And of course that doesn't, at the end of all of that time, nothing's changed. So maybe just give it a go. Just say, hey, I need this from you, please.
Yes.
See what happens.
Yeah. So amazing. So now we're going to do Q&A. If anyone has a questions, please, for Dr. Francis, please comment through. And while we wait for your questions, we're going to ask Dr. Francis about, where we can find you and anything new coming, or, all those things.
Yes. So really, I guess my work from this year will be across two main places. So one is my face-to-face GP work, and then my other side that I'm developing more this year is my online world. As I said, is the classes. I'll talk about that more. So in my general practice world, I'm at two practices. So Hope Island Medical Centre, that's where I do general practice, so really everything. And then I'm also at Grace Private with the lovely team there, working more in that traditional women's health space. So that's our pre-pregnancy, fertility, pregnancy management, postnatal, and then our gynecology things, so contraception and period concerns, menopause, those sorts of things, is the design of Grace. And then, as I said, in my online world, I get it. I get the journey of being pregnant. I've done it a few times. Yes. I get the journey of being with a new parent with a baby. I've done that a few times too. And I know that there's so much information. I know that, one piece conflicts with the last piece. And I know that's difficult. I also know how it is for time. One, when you're pregnant, you think when you've had a baby, you think you have all the time in the world when you were pregnant, but you don't. You're working and doing things. And then when you have a baby, of course, that's just a way full-time job. And so it's hard for women to go and see, professionals for education. It's booking in, it's getting in, wait lists. All of us have wait lists. So I know in those moments women, are struggling with something, whether it's this baby won't settle, this baby, I can't feed this baby, I'm having a problem. In that moment, that woman needs help. So my hope is that by developing this, these super easy, really light online classes, you can just jump on and go, oh, yes, okay, let me try those steps. Let me do this. Okay. Or, that's what I need to do. Or, oh, okay, I don't need to worry about that. That's okay. That's normal. I'll let go of that. That's kind of my hope with that world. So it's very exciting. I'm really looking forward to seeing how that, and of course I would welcome anyone if you have something you want me to present, because I'm doing some video interviews now on my website, and I want to create things that help women. And I'm a woman and I've done a lot of things, but I'm not every woman. And so I very much welcome if anyone has topics they would like me to dive into. I'm happy. I'm here for my community. So, yeah.
Thank you. That's beautiful. And I love that, your online classes are going to be very easy, like not, so I think, and what happens is like if it is easy to follow, and, it's easier for moms to, not sit there and just do hours of work, and they can.
We don't have time. And that's typically what antenatal education has been about. It's been, big full days or multiple evenings or big courses jam-packed full of lessons. And look, absolutely, they're amazing. And there are some women who love learning and want everything and enjoy that. And that is so wonderful. But I know that in a lot of my cases, women just want to know now. I just want it now. Give it to me the fastest way you can give it to me, please. In fact, if I offered you the choice, here's a USB, just plug that into your brain and get the information, people would choose that, because why wouldn't you? Why sit at a computer for hours on end? You want to just go, oh, okay, 10 minutes for here. I want to know this in 5 minutes. I want to know this in 10 minutes. I want to know this in... So we'll see. I mean, people will tell me ultimately what they like. People will let me know if that suits them. And of course, I always welcome that feedback.
So, I'm very positive that you will be really successful, because you are so committed to the community, right? And then and community will see that, and, they will come to you. And, so I think that's it for today. And it was amazing to have you in our community and educating us, and and looking forward to maybe next one.
Ooh, okay, booking in already. That okay, that sounds good.
Yes, parenting. I'm doing all planning, the whole year planning, and so yes, so I'm contacting everyone who I can do live with, and so
parenting's a big one. Yes, definitely. Please cover parenting. There's a lot in parenting that we can support women with, I think.
Yeah, amazing. Thank you so much, Dr.
Good. No, thank you for having me.
And you have a great afternoon, and we'll see you. Bye. Bye. Thank you, everybody, for coming. Thank you.
Bye, guys.
Bye.